Hey, what's up? This is Corey Dion Lewis, clinical health coach and host of the Healthy Project podcast. Now, the research shows that social determinants can have a greater impact on your health more than healthcare or lifestyle choices. The purpose of this podcast is to discuss how to improve health and reduce health inequity by speaking to healthcare professionals, thought leaders, and entrepreneurs. Now, if you're enjoying the podcast, give it a review. Or you can also make a donation to the Healthy Project using the link in the description. It takes 30 seconds and it's super easy. Hey, thank you so much for listening. Now let's get started.
Thank you for tuning in to the Healthy Project, My City, My Health Edition. I'm Krisha and I'm going to be your host this afternoon. I'm a junior at the University of Iowa, majoring in psychology and minoring in gender, health, and healthcare equity. I'd like to thank Corey for joining me this afternoon. Before we get started, would you like to tell the listeners a little bit about yourself?
Absolutely. So, Corey Dion Lewis, I am a clinical health coach and founder of the Healthy Project and host of the Healthy Project podcast, where we talk about social determinants of health, health equity, prevention, and just how we can improve the health of individuals and communities with other health professionals.
Really cool stuff. I know you've been working really hard on the My City, My Health conference, and I was kind of wondering, what does this conference mean to you?
Oh man! So this conference, it means multiple things, and it would be necessary to kind of start to like why we even started this event. And I've told this story numerous of times because there's some correlations between why I started the Healthy Project, and that is my mother faced some pretty serious chronic diseases, and after we moved her to live with me to kind of help her focus on her health and wellness, realized that she wasn't getting the quality care that she deserved. And as I told the story of my mother and her healthcare journey, other Black women were telling me similar stories of how they were treated in healthcare. And that's where the conversation for me changed a little bit about, okay, not only, the stories I was hearing about, Black women and how they were treated in healthcare, but other stories and how just people in general who are treated have negative experiences, and having conversations with Black men who refuse to come in and get their preventative checks because of the issues they are having in healthcare and all of that. And so that's one thing of understanding that culture and people there's a mistreatment there from the patient side, but also the lack of people of color in those professions and how that plays a role. So all those things started to come into play for me. And then, like I said, I am a clinical health coach at a federally qualified health center here in Des Moines, Iowa, and this is the population that I serve. So social determinants, health equity, working with people in underserved and most vulnerable populations is what I do every day. And I've had experiences where I could be speaking with a patient who's diabetic or pre-diabetic, and they get their meals from the food pantry, or they get X amount. They had their food budget is super, super low, or they're not concerned with their medication or their diet because they're trying to figure out how they can get money for rent. So these are real things that happen to people where they're just trying to live, and unfortunately, the struggles that they are going through to just live day to day is killing them because they can't focus on their health. So all of these things played a part in creating a space for professionals to come together and have a conversation around, yes, we know that there are issues when it comes to racism and culture in healthcare. We know that when it comes to prevention and getting people to get those services, and we understand there's an importance and there's positive things that happen when we collaborate with community-based organizations. We know these things are true. What are we doing about it, and what are the solutions? So, um, I went off on a tangent, so I apologize. But that is,
No, you're,
but that's all. That's what it all is, and it's just a passion of mine to just continue to have this conversation, and really have people come together to figure out, what are the solutions, and what can we do to just better serve our community.
yeah, everything you do is super inspiring, especially since you had that personal connection with your mother, and you kind of want, and you realized like others were going through similar experiences and kind of just wanting to improve the healthcare for everyone. It's really inspiring what you've been doing, Corey.
No, thank you. I'm sad that it took, someone close to me to like realize this was happening, but that's just kind of how it goes. But I'm happy that we have people that are joining us that are really really excited about change, and really um, excited about where we can do within our community.
Yeah, for sure. So, kind of going a little bit off of that, what has been your favorite part of organizing the My City, My Health conference?
Oh man, so that's a fun question because the beginning when I first started it, just the idea and coming together with people who are excited about the conversation, and just saying, okay, this is how conferences are usually ran. How can we do it differently? What can we do differently? And that what was so fun about it is the goal is to do something that, not that no one's never seen, but that you're not used to seeing in a conference with health professionals. And the idea is to really highlight um, culture, and just have people really enjoy the time there, and really um, come away with ideas and solutions, and to really enjoy themselves. Not only have get the value from the speakers, but also leave and go, hey, that was a good time, and leave motivated. So that was the most exciting part around organizing this, is just coming up with ideas on how we can make this different, and the excitement from other people when talking about it, and how excited they get around just being a part of what we're trying to do.
Yeah, for sure. Like it's going to be super motivational for everyone to hear, but you want to also make sure that they're leaving the conference with like kind of like an action plan of like how they can get involved with this big effort.
Yeah, absolutely. That's my one ask for everyone that is in attendance, that is speaking, is the goal. My call to them, or my challenge for them, is to leave with one idea, one big idea on how they can either change their their self, or change their community in one positive way. That is the one ask. So hopefully, with the four panels that we have, from culture and healthcare to prevention to mental health and community collaboration, you can leave this event with one idea to change your circle in a positive way.
Yeah, for sure. Kind of transitioning now to your work as a clinical health coach. How does
Yeah.
racism show up in your career?
Yeah, and this is a really good question. Is one I had to really think about a lot, because when I look at racism uh, from a health coaching perspective, there are a few ways that I've seen it. It's not necessarily someone being racist towards me per se, as a black health coach, but
Mhm.
someone who sees me as a black health coach and wondering, okay, is this person going to give me the uh, care that I need? And what I mean by that is, over the past few years, especially within the political environment, there are a lot of people that it was just a rough time around George Floyd, the president at the time, and as the health coach, I see everybody, and when I have somebody on my schedule that may not look like me or maybe wearing a "Make America Great Again" hat, and they're looking at me like, okay, what's going to happen here? And I'm looking at them like, okay, what's going to happen here? And it's a tricky thing. So it's like it goes to that bias, that unconscious bias that we have. You know what I mean? When you see something and you try not to, but it happens. It triggers an emotion, but the important thing is recognizing that and being able to can still be a professional and help everyone I can to the ability that I can. So that is there when that's I do see that just as a black professional or a black health coach in a clinical setting trying to help patients. And the other thing, not necessarily um, racism, but just the comfort people have with me that look like me. You're comfortable around the people that you share a cultural identity with. So there are times where patients will tell me things that they necessarily will not tell their provider. You know what I mean? Just because there's a trust with me that they may not have with their provider. I'm not saying that their provider wouldn't do the right thing, but it's they see someone that looks like them and they are more they're more open and honest sometimes, and sometimes it can be stressful because they're telling me things I way out of my scope of practice. But the important thing is I can help them in a way that they felt like they couldn't be helped before. So that's been good.
Yeah, like they might feel like they're able to better relate with you because you might have gone through like similar experiences and things like that.
Yeah, absolutely. And there was one situation I had a patient that they're not from Iowa, they were from Arkansas, and uh, diabetic, and we're just kind of talking, and I just through conversation and building rapport and trying to get to know them, let them know that I had family in Arkansas, right? And ever since then, they were like, "Oh, you're from Arkansas." So they had that connection that I'm like, "Well, I'm not from Arkansas," but for them, the fact that okay, I look like them, I'm from their same place, so I can understand them, the way they're speaking and communicating, because it was for some people it was very hard to understand, but being able to talk to someone that, oh my gosh, I'm talking and they can actually understand what I'm saying, that is very important to people, man. Just like being able to understand small cultural things, in lingo and things that um, when they would say to someone else, they may not understand it or even ignore it, but someone who understands them and being able to know what they're saying and accept what they're saying and being able to translate that in a way, it was important to them.
Yeah, for sure. So, like, what are some ways you try to strive to provide culturally responsive care to your patients?
Yes. So um, I just ask questions about different cultures. So if someone's in my office that is from a different culture, so we've had a lot of Afghan refugees here that coming through our clinic, and if I see a patient, it's just that first 20 minutes, I'm not even really talking about the reason why they're in my office, whether it be they're wanting to lose weight or get healthy or whatever the case may be. I'm just asking about their culture because I'm not going to act like I'm the expert. That would be the worst thing to do. So I'm just asking questions. I'm learning, you know, what are cultural significant foods, and that's something that's really benefited with working with patients, working with someone, you know, that I just learned this not about a year ago, I can be working with someone from Mexico, but also working with someone from Peru, and they have different main foods. You know what I mean? And they're like, no, like, yes, we both speak Spanish or both Latine, but in Peru, these are our main foods, this is what we eat. Or in Mexico, these are their main foods. And without asking questions, you wouldn't know that. And what tends to happen if I were to just assume that, okay, being Spanish speaking, these are the main foods, and then bringing that up to them in a food, pyramid or my pyramid or whatever, they're like, wait, what? And that can just throw us off. That can
Yeah.
completely throw us off. So, um, if I don't know, I don't mind asking questions at all. I actually enjoy it. I learn so much from the different cultures that I'm able to work with at Broadlawns. That uh, if I weren't able to ask questions, it'd be hard. And the patients really appreciate it too. They love talking about their culture. You know what I mean? They're proud of it. So being able to get that out of them, and not only do I learn something, but it builds rapport between them and I. So we're able to build a stronger relationship because of it.
Yeah, and it's like remember, like, you're always learning every day, and like kind of take that as an opportunity to get to know like other perspectives and cultures even more.
Yeah, absolutely. And I will say I have a lot more time to work with patients than a lot of providers do. So, average provider sees a patient, I think the average time is 10 minutes, 10, 15 minutes.
Hmm.
If that, I think 15 minutes is pushing it, but around 10 minutes is the average visit. And I'm seeing patients for 20, 30, 40 minutes, being able to really get to know them. So yes, that is a benefit, but I will say that being a part of that care team and being able to do that, um, it really improves the overall care for that patient just by being able to have that time and to understand where they're coming from culturally.
Yeah, for sure. As we mentioned earlier, you're the founder of the Healthy Project, which is a public media company that speaks with different healthcare professionals and thought leaders all over the world. I was wondering what's been your most rewarding part of this experience?
Man, good question. And um, what's really been rewarding for me is honestly what you just said, being able to speak with people from all over the world. I would have never imagined just having a 30, 40 minute conversation with someone in Australia or someone in, Greece, and having an instant connection because we share a common passion, and that's helping people, and that I have great friends from it that I still connect with today, and we'll have Zoom chats just to check in on each other, and it's that has been one of the funnest things of it all is really, and even and with the way I do my podcast is mostly very just conversational. So being able to listen to these professionals who are high up wherever they are. I mean, some solid people. Just being able to hear them in more of a laid back way, it's just fun to see too. Like they're just laid back, just talking about something that they enjoy, and it's just fun. It's been a fun experience, and just being able to connect. And hopefully, I can continue to do this for years to come, and can just connect and learn from, um, and just hear. stories from people from all over the place.
Yeah, it would be really cool to hear like different perspectives and see how, and you'd even be able to learn like how leaders in other countries are handling certain problems in healthcare and things like that. And maybe we could be adopting those into our practices here.
Oh, absolutely. This was probably a year ago. I had a friend on that is he's a health coach in England, and he runs a diabetes management program. And just kind of, there are some similarities in how we speak to patients, but there are some things that he does that um, I wouldn't even think about. And a lot of it's because of the different cultures that he works with, or the majority of the cultures he works with, and the things that they do where he lives. But I feel like things that would translate here very easily. So I've been able to learn a lot, and we've been able to learn from each other. So yeah, you're right. I mean, it's been just being able to hear how um, the same problem, but just different solutions and ideas that you can hear from people has been amazing.
I know today we've discussed lots of different ways to improve culturally responsive care. What is one thing that you'd want our listeners to take away from our conversation today?
One thing, if there's one thing that I want people to take away from this conversation, is when you're in an environment with people that don't look like you, just ask questions. I want you to ask one question. Get to know them, not them just as a person, but them, what their culture. There, it is a very uncomfortable conversation for some people. I don't know why. It doesn't have to be an uncomfortable conversation to ask someone about their culture. You know what I mean? Because you're trying to learn about them. And I feel like by breaking that barrier and doing that, not only are we able to improve health equity by understanding cultures and how we can improve health, but we're able to get this closer together as a freaking a nation, as a world, and just being able to understand us people more. And the better questions that we ask, the closer we can come together as a whole community.
That is a really nice sentiment. And it's some I feel like sometimes we're always the ones talking, but we need to remember it's important to listen to others as well.
Yes, yes. In health coaching, one of the sayings is, if you're talking too much, you're doing it wrong, right?
Mhm.
And the goal is to have the person that you're trying to help do the majority of the work, do the majority of the talking, and you're just listening. And you're right. We can do too much talking sometimes, and not enough listening. And that is kind of the soul of my city, my health. Is we've done enough talking as a healthcare community. It's time to listen to the people and come up with solutions to continue to help.
Exactly. I would like to thank you so much for joining me this afternoon, Corey. And to our listeners, be sure to sign up for the My City, My Health conference happening on November 11th from 9 a.m. to 3 p.m. And you can do this at mycity.health. There's an in person component as well as a virtual one in case you're not able to make it down to Des Moines. Thank you.
Awesome. Hey, thank you. You've been a great host. Natural. I really appreciate you.
Thank you.
All right, take care.